Okay. So the question is, what about acupuncture for pain? It's an interesting question. Acupuncture was once thought as bizarre, foreign. Um, it's now rapidly becoming mainstream treatment for pain, especially in the West, where I was practicing recently in Arizona. Um, Studies have found that it works for pain. It helps relax you. It helps bring neuropeptides and anti-inflammatories to the areas. It seems to help with many painful conditions, including fibromyalgia, osteoarthritis, rheumatoid arthritis, back injuries, and sports injuries. And it can be used in conjunction with massage. It may block pain signals by releasing some what we call some pain-numbing chemicals, to not get too fancy. And there's good scientific evidence for it, um, as prescribed. There's really good data out of the UCLA Pain Management Center. Now, saying that, I may have a little bit of a skewed view. I don't know how many of you know my story, but basically, I was a neurologist and became a pain management doctor, chronic pain management doctor, mainly focusing on neuropathic pain. And then I um, got hurt. Motor vehicle accident, old gymnastics injuries, old sports injuries, kind of added up on me. Then I fell, and I had shoulder surgery. Things didn't go that well. I ended up on medications, another surgery, and ended up with a frozen shoulder syndrome, uh, neuropathy, borderline diabetes, sleep apnea, getting overweight, sedentary, um, hypertension. Things just kind of spiraling out of control in both pain and health, and that of course affects your life. So I was having some suffering, couldn't do my job as I needed to, energy levels down, all kinds of problems. So I decided to look for other opportunities for pain management outside of um, what classically I had provided for certain, and outside of where I'd gone. And I went into a lot of different realms, but what I found was a physical therapist in Phoenix, Arizona, who did acupuncture, physical therapy, helped me with activation and massage, and everything started to turn around. I was on a long-acting narcotic called Cadian. I got off of almost all my medications. I went to herbal therapy, devil's claw. At first, actually, I used some other anti-inflammatory herbs, and I used some rescue herbs, and I used ginger and turmeric and some various things, and I ended up just on devil's claw now. Um, but with some anti-fatigue adaptogens like eleuthero root and American wood ginseng and Panax ginseng. I also use some other adaptogens sometimes, but the point is, acupuncture helped me a great deal. It changed my life. It changed the way things went for me. Um, it wasn't the opportunity I was expecting to find, but it was. That's why you guys gotta always keep looking for the right opportunity, because acupuncture ended up changing my pain syndrome, changing everything for me. Excuse me. I Within weeks, my shoulder pain was much better. I was activating, I was exercising, I was getting into physical therapy. Things really turned around there. And with that relief of pain, I was able to relieve my back pain better with activation, with other things. I started exercising, my health got better. No longer have sleep apnea, no longer have borderline diabetes, no longer is obese, no longer have the those health issues. I'm on no medications, diet, exercise, herbs, and when things get bad, massage and acupuncture. So acupuncture turned my life around. It was the opportunity that I needed to make a change. And after I made that change and found my pain relief to get me started down the right path, I found some other options, and I got away from those things that were actually doing some harm to me. Not that they do harm for everybody, but they were not the right path for me. And I got on the right path of pain care. Once that happened, I could change my life. I could get rid of the suffering of change in job, loss of energy, find a new path. And I did. So I think acupuncture is great. Longer answer than you thought you'd get, huh? Yeah, alright. Let's move on. Another question.